Hi everyone, today we are going to discuss about ventricles in brain. There are 4 ventricles in the brain. They are lateral ventricle, third ventricle, fourth ventricle and central canal of spinal cord and medulla oblongata. These ventricles are just cavities. It is lined by ependyma. This is neural tissue. And it is filled with cerebrospinal fluid. This cerebrospinal fluid is secreted by choroid plexus. Every part of the brain structures, including ventricles of brain, are derived from the neural tube. This neural tube is divided mainly in 3 parts. They are prosencephalon, mesencephalon and rhombencephalon. This prosencephalon further dividing as a telencephalon and diencephalon. The lateral ventricle and the third ventricle are derived from the telencephalon and diencephalon respectively. There is no ventricle in the mesencephalon, and like the fourth ventricle is derived from the rhombencephalon. But from the mesencephalon, aqueduct of Sylvius or cerebral aqueduct is derived. The spinal canal is derived from the spinal cord. Let's see the ventricles one by one. Lateral ventricle. There are 2 ventricles in the brain, one in each side of the cerebral hemisphere. The lateral ventricle roughly C-shaped, so we can divide anterior cone, body, inferior cone and the posterior cone. The anterior cone is located in the frontal lobe, like body in the parietal lobe, inferior cone in the temporal lobe, last posterior cone in the occipital lobe. In between the 2 lateral ventricles, there is no connection in between because it is separated by the septum pellucidum. But there is a communication in between the third ventricle through the interventricular foramen or foramen of Monro. The foramen of Monro is in the anterior part of the lateral ventricle of its medial side. Okay, this is the third ventricle. It's look like a narrow cavity or slit-like cleft in between 2 thalamus. Okay, and there is a connection in between the lateral ventricle and the third ventricle through the interventricular foramen anteriorly, like posteriorly it connects through the aqueduct of Sylvius or cerebral aqueduct to fourth ventricle. This is the fourth ventricle. This fourth ventricle is very important because in essay questions they will ask describe or write short notes on floor of fourth ventricle. So the boundaries of fourth ventricle, about the fourth ventricle is very important. Okay, this is the fourth ventricle. This fourth ventricle looks like tent shape. Tent mean in side view there is a triangular shape, and from above it is above this is diamond shape. Okay, let's see the boundaries of the fourth ventricle. It is situated in front of the cerebellum, like posterior to or dorsal to the pons and superior half of the medulla oblongata. First we will see the roof. Okay, the roof of the fourth ventricle project backwards. Here you can see backwards into the cerebellum. Okay, here there are 2 parts in the roof. Superior part of the roof is made by the superior medullary velum, like inferior part of the roof is made by the inferior medullary velum. Next, floor of the fourth ventricle. The floor of the fourth ventricle made by dorsal aspect of the pons and the dorsal aspect of the medulla oblongata. The medulla oblongata part, above part of the medulla oblongata. Okay. The fourth ventricle floor is also referred as the rhomboid floor. Let's see the floor of the fourth ventricle. The floor of the fourth ventricle is known as the rhomboid floor or fossa. The upper boundaries are formed by the superior cerebellar peduncle, like the lower boundaries are formed by the docile and cuneate tubercles and their underlying nucleus. Above them, you can see the inferior cerebellar peduncle. You can see the midline roof. It is called median sulcus. It is formed from the aperture of the aqueduct above to commencement of the central canal below. On each side of the groove, the floor is symmetrical. You can see the widest part of the floor. The floor is transversely crossed by the white fibers. It is called medullary striae. By the medullary striae, the floor is divided into two triangles. The above one is bigger than the below one. On the above triangle, you can see a elevation. It is adjacent to the median sulcus. It is called facial colliculus. It is formed by the recurving fibers of the facial nerve overlying the abducen nucleus. On the below triangle, immediately below the medullary striae, you can see a trigone. It is called hypoglossal trigone. It is overlying the 12th nerve nucleus. It is medial one and in its apex is down. Like here you can see the below the hypoglossal trigone, there is another area called vagal area. It is formed by underlying the dorsal nucleus of the vagus, and it is in the lateral angle, and its apex is upward. At the lateral angle of the floor, spanning over the pons and medulla, you can see an area. It is called vestibular area. It's overlying the vestibular nucleus. Let's see the central canal. This is a continuation of the fourth ventricle. It extends from the inferior half of the medulla oblongata, and it is in the entire length of the spinal cord, and it is lined by the ependyma, but there is no choroid plexus in the central canal. You can see this is the choroid fissure. It is in the medial side. It is at opening of the C-shaped slit. Okay, through this choroid fissure, the pia mater is entering. Okay, ependyma lining of the lateral ventricle come into contact with the pia mater. Okay, this is the point important. Next, mass capillary enter and invaginating the pia mater. Both together is called telechoroidae. Before the telechoroidae, you can see the ependyma. Okay, choroid plexus is formed by telechoroidae and the ependyma. This choroid plexus, the choroid plexus, you can see the CSF is secreted by the choroid plexus. Okay. Okay, you can see there is a connection in between the lateral ventricle and third ventricle is interventricular foramen. Choroid plexus of the lateral ventricle comes through the interventricular foramen to third ventricle. The third ventricle and fourth ventricle choroid plexus are in the roof of their on ventricle, but the fourth ventricle choroid plexus is a separate one. Let's see the choroid plexus of the fourth ventricle. It is look like a T shape. The vertical part is double, and it is from the inferior roof of the fourth ventricle. And this blood supply from the fourth ventricle, the choroid plexus of the fourth ventricle, blood supply from the pica mean posterior inferior cerebellar artery. Like for the third and lateral ventricle, it is from the anterior choroidal artery. I have told you the cerebrospinal fluid is secreted by the choroid plexus. What is cerebrospinal fluid? It is a clear fluid, colorless fluid, and it is in the ventricles, subarachnoid space and the central canal. Okay, this is the circulation of the cerebrospinal fluid. From the two lateral ventricle, it will go to the third ventricle through the interventricular foramen. From the third ventricle, it will go to the fourth ventricle through the aqueduct of the sylvius. From the fourth ventricle, it can go to the spinal cord. Like it will go to the subarachnoid space by the foramen. They are two lateral aperture called foramen of Lusca and one median aperture called foramen of Mageddon. From this subarachnoid space, it is absorbed by the subarachnoid villi to the superior sagittal sinus. Okay, if there is a defect in the circulation of the cerebrospinal fluid, we will see some clinical problems. Most common problem in the circulation of the cerebrospinal fluid is the hydrocephalus. What is hydrocephalus? It is an abnormal increase of the cerebrospinal fluid. It leads to enlargement of the skull, especially forehead, and expansion of the ventricles and atrophy of the brain, like increased intracranial pressure. The hydrocephalus is a condition which there is a disequilibrium between the absorption and the secretion. Okay, we can see most common problem is the increased intracranial pressure and enlargement of the ventricles. Okay, in the hydrocephalus, we can divide into two. The types of main types are communicating and non-communicating, or non-obstructive and obstructive hydrocephalus. What is the communicating or non-obstructive hydrocephalus? There is a problem in the communication. Okay, so increased secretion or decreased absorption. What are the conditions? If there are any carcinoma or papilloma in the choroid plexus, like decreased absorption. What are the conditions? If there are any scarring of the choroid plexus after the meningitis or hemorrhage. Meningitis mean inflammation in the meninges, or post meningitis or post hemorrhage. Next, we will see the another type of the hydrocephalus, non-communicating or obstructive hydrocephalus. There is a no communication between the ventricular system and subarachnoid space. It might be stenosis or block in the pathway. Example, block in the aqueduct of sylvius. Okay, here you can see some pictures of hydrocephalus. Okay, next we will see the treatment of the hydrocephalus. There is a two treatment. One is make a shunt, and another one is the ventriculostomy. Ventriculostomy mean put a hole in the organ and make a surgery. In the ventriculostomy, put a hole in the ventricle and drain out the excess cerebrospinal fluid. In the shunt, there is a two shunts. One is a ventricular peritoneal shunt, and another one is the ventricular atrial shunt. Shunt between the ventricle and the peritoneum peritoneum, like shunt between the ventricle and the atrium. Okay. I hope you all are understood about the ventricles of brain. Thank you.